right now, we have other breaking news as well. The city of San Jose just released an update on how they're going to handle the COVID vaccination policy. All city employees have to be vaccinated. Here's what they're doing, though. The deadline is now, but they're extending that. There's now a 1-week grace period to be vaccinated. If you're not vaccinated after this week of grace period, then you're going to be placed first on a week unpaid suspension, and that's the first step in the disciplinary process. Then, if you're unvaccinated, you're going to, and continue to be, well, then you're going to have to test negative twice a week at your own expense. That's the rule. If you refuse the testing, well, then you could be terminated. Wow, more breaking news on top of that. And this is good news, a magic pill. Merck says it has an effective COVID pill. This is the first COVID pill that has been developed that could reduce your risk, cut in half your risk of hospitalization and death if you get COVID. Crown 4's Camila Barco is live at the Merck Research Labs in South San Francisco with more on how this pill works. Good morning.
Good morning, Daria. So yeah, right now the next thing for Merck executives to do is submit all of the information they found about this pill for review, and they say they're going to do that in the next few days. Now, like you said, the results from their trial run showed that your chances of hospitalization or death is cut in half when you take this pill. Now, the patients involved in the research received it within 5 days of showing COVID-19 symptoms. Merck tracked 775 adults who had mild to moderate COVID-19. They were not in the hospital, but they were considered higher risk for severe disease due to health problems. There was another group of patients. They received a dummy pill, but they suffered severe symptoms. Now, the pill was so successful that a group of medical experts told Merck to stop the trial runs early because the initial results were so strong. The drug is designed to stop the coronavirus from replicating, and it's meant to be taken as 4 pills twice a day for 5 days. At this time, it's unclear how much it will cost. Now, we spoke to Dr. Peter Ching Hong, a local infectious disease expert about the new pill, and here's what he had to say.
It's going to be for early treatment. It'll probably be something you can easily get prescribed. And the most amazing thing is, I think there's going to be evidence coming up soon. It's being studied now that even in contacts of people who have COVID, that you take the pill and it will prevent you from getting infected in the first place.
Now, despite there being a COVID-19 pill in the works, medical experts are still pushing for the COVID-19 vaccinations. They say that is the best way to prevent yourself from getting COVID or reducing the chances of ending up in the hospital. Now, Merck, the pharmaceutical company, says that they can produce 10 million doses of that new pill by the end of this year. The U.S. government is prepared to purchase more than 1 million of those doses. That's if the drug is approved by the FDA. Daria, back to you.
Thanks so much, Camila. And if you have more questions, we actually